Listen up ladies, if you have IBD and have been struggling to get pregnant and it seems like no matter what you've tried and you still have no luck, then stick around because in this video I'll give you tips on how to improve your fertility with Crohn's disease and ulcerative colitis. Welcome back to my channel, the only place for Crohn's and colitis tips, tricks and information. So make sure you subscribe to my channel and hit the bell to be notified every time I post a video. And if you want to join an exclusive community of people who receive tips and tricks on living with Crohn's disease and ulcerative colitis, make sure you sign up to my newsletter and you can find a link to that in the description box below. Right, so fertility and pregnancy is one of my many interests, and when I finished my master's degree in reproductive medicine, I worked in pregnancy and fertility research for a few years. So the very first thing for you to do if you've been trying to get pregnant with your partner for a long time is to actually go and get a fertility test. This includes your partner as well, because if he is shooting blanks, no matter how many times you try, you just won't get pregnant. And if you want to know what options there are if this is the case, then check out these videos and I'll put the links for those in the description box below. So if you know your eggs are fine and that your partner's sperm are also fine, then here are a few things you can do to boost your fertility. So number one is quit smoking and drinking. Smoking can actually reduce fertility and is also linked to complications in pregnancy, and excessive drinking can impact on your partner's sperm as well. So if he's a heavy drinker, try getting him to cut back as well. Next is folic acid supplementation. Before taking any supplements, you need to discuss this with your doctor, but in general, folic acid supplementation needs to be taken while you're trying to conceive and then up to the 12th week of pregnancy because it helps reduce the risk of neural tube defects. Try getting a full checkup from your doctor because if you have IBD, then you may have other nutrient deficiencies like vitamin B12 and iron deficiency, which are also important for fertility and pregnancy, and so you may need to get supplementation for those as well. Next is to avoid taking certain medications. Obviously, if you have IBD or any other condition, do not stop taking your medication until a doctor has specifically told you to. However, some IBD medications can affect your partner's sperm, such as aminosalicylate and methotrexate, so check with your doctor if your husband or partner are on any of these medications. I have gone into much more detail on this, on the impact of IBD medications on fertility and pregnancy, so check out this video and the link is in the description box below. Next is to try and relax and not get stressed. If you want tips on how to manage stress and anxiety, then watch these videos. But stress can have a massive impact on your overall health and can lower you and your partner's sex drive, and so can make you lose interest in having sex despite wanting to conceive. Diet and exercise is also important. Eating a well-balanced diet and maintaining a healthy BMI is important, as overweight and obese women can have reduced fertility due to their weight. So exercising and eating right can help improve your overall health by reducing weight and help improve your fertility. Lastly, one of the ways of increasing your chances of having a baby with your partner is to have regular, unprotected sex. And there you have it, a few simple suggestions to improve your fertility. As mentioned, it is important to speak to your doctor about fertility concerns that you or your partner may have, but if you want to know more on the most common fertility concerns in Crohn's and colitis patients, then make sure you check out these videos and the links to those are in the description box below. And while you're doing that, make sure you check out these videos on more useful tips, tricks and information for Crohn's and colitis. Don't forget to hit that subscribe button and the bell to be notified every time I post a video, as well as leaving a like and a comment if you enjoyed this and found it useful. I can't wait to see you all in the next episode.